You might think you know what ketamine infusion therapy is about, but if you're watching this video, you may have some questions. So in this video, I want to share with you what ketamine infusion therapy entails, a little bit about the background of ketamine, and one tool that you can use to maximize your ketamine infusion therapies. I'm Dr. Ko from Reset Ketamine in Palm Springs, and I want to share with you a little bit more about ketamine therapy. So what exactly is ketamine infusion therapy? Well, ketamine was invented in the 1960s, and it was FDA approved as a general anesthetic in 1970, meaning its use is in the operating room and the emergency department. However, after that period of time where it was used extensively in the hospitals, there were additional studies that came out in the early 2000s that were showing, wow, this can be really effective in patients with depression. So this was kind of a serendipitous finding. And then more research studies were done looking at depression, looking at PTSD, looking at anxiety. So since that point, when that first research study came out, ketamine clinics have opened up and offering this as kind of an alternative, cutting-edge therapy for these various mood disorders. During the ketamine therapy, we typically start with 6 initiation series, which are done in a short period of time, roughly 2 to 4 weeks, kind of in a condensed period. And after those 6 initiation series, some patients will get maintenance boosters, which might be every 4 weeks, every 6 weeks, every 8 weeks, kind of depending upon how their symptoms are doing. Now, during the ketamine therapy, remember, it was originally invented as a general anesthetic. This means a lot of clinics are going to be monitoring your vital signs, and that's including your blood pressure, your cardiac rhythm, your oxygen level, your respiratory rate, just to make sure it's safe. We have seen where patients will get really high blood pressures, or even their oxygen level may drop, which is why it's really crucial to have a professional monitoring those vital signs to make it as safe as possible. And finally, as promised, I want to share with you that one tool to maximize the ketamine infusion therapy. And that tool is called setting an intention. So what do I mean by that? Well, an intention, you can think about the question, what do you really want? What is the goal behind undergoing this ketamine therapy? And it might be something simple as letting go of the past, feeling more content, feeling peaceful, feeling safe, having gratitude. So each person will come up with their own unique intention at our clinic, really focused and custom tailored to what they personally know that they want to get out of the experience. And during the ketamine infusion therapy, this is something that you're going to be repeating to yourself as a mantra. What is my intention? Why am I sitting here in this chair? What is my goal from this? And by using this intention as your tool, it can help you. Remember, one of the ways that ketamine works is by increasing neuroplasticity, literally changing neurons. Neurons are our brain cells, and in between each neuron, they communicate with each other via synapses. So we know that ketamine rapidly increases neurogenesis, strengthens synaptic connections. So what I think is that what the person is thinking about during the ketamine infusion therapy can impact how those synapses are connecting, how the brain is changing. So by using that intention as a tool, you can really maximize your ketamine infusion therapy.